Through lobbying and through expenditure on dubious trialing methods, through controlling the stories around food, through controlling the stories of nutrition, it seems that an industry is devoted to creating new clients, new patients, new consumers for their products. Is it fair to say that the undue influence that big food is able to exert on organizations that research subjects like diabetes, heart conditions and heart disease, oncology and cancer, that we're simply not getting the real picture of how we ought to eat and what's healthy? And imagine if overnight processed foods were banned, annihilated, and people just ate healthy, what would the difference be?
Yeah, so working for Coke 10 years ago, we had a strategy. Now, processed food companies contribute 11 times more money to nutritional research in the United States than the NIH. They're basically, processed food companies are funding research, and the direct strategy was to fund thousands and thousands of studies to complicate the issue. Still, to this day, elite research institutions are putting out studies questioning whether sugar causes obesity. It's mass confusion. And then, as you mentioned, the medical system is totally silent on that, right? The medical system is not ringing an alarm bell about childhood diabetes, obesity. They're profiting from it. And I think the key thing to understand is that we've siloed health in every institution, from pharma to med schools to your hospital. They make money on interventions of people that are sick, right? We spend $250 billion on cancer. We spend over $1 trillion on diabetes care. The most prescribed drug in the country, 25% of the United States is on a mental health medication. 40% of men over 40 in the US are on a statin, right, to prevent heart disease. The problem is all of the conditions I just mentioned are going up. As we're treating them, as we're spending trillions of dollars to treat these conditions in silos, they're all getting worse. Rates of everything is going up. It's because the foundational reason for all of the diseases you mentioned, Russell, it's because of food, right? If you are metabolically healthy, if you're eating healthy food, if you're at a normal weight, you're very unlikely to die from COVID. You have an almost 0% chance of getting diabetes, heart disease, even Alzheimer's, which is now called type 3 diabetes and is highly tied to metabolism. So we are ignoring the actually simple root cause, and this is by design. People getting sicker and sicker and us kind of confused about why that is helps the medical industry profit. I was actually debating a leading Harvard doctor who is a big proponent for Ozempic. She's saying that obesity is actually a genetic disease, not tied, quote, to food or lifestyle. They're literally arguing that at Harvard. She said she does not know why there's a crisis of childhood obesity, and it's, quote, complicated. This is not complicated. We are being poisoned from a rigged food system, and the medical system is profiting.